Hello, everyone, and hello to my special friend and colleague, Susan Reinhart. Welcome to the Campaign for Action's Future of Nursing Passion, Purpose, and Progress event. I'm Sue Hassmiller, Senior Advisor for Nursing at Robert Wood Johnson Foundation and Director of the Future of Nursing Campaign for Action.
Hi, Sue. It's always good to share a podium with you. And I'm Susan Reinhart, Senior Vice President and Director of the AARP Public Policy Institute and Chief Strategist at the Center to Champion Nursing in America and for the Family Caregiver Initiatives. Welcome and thank you for joining us today. We're thrilled to spend this time together. Before we get started, however, let me just go over a couple of details with you related to today's event. First, of course, technology. I know we've all gotten much more familiar with virtual meetings over the last year, and that's a good thing. For today, we recommend using Chrome Internet Browser for an optimal viewing experience. If your screen freezes or you lose audio, please refresh your browser. You may also want to close programs or applications that you're not using. We also encourage you to engage through the chat feature. Feel free to post questions or comments you have, and we will do our best to respond today. If we can't get to everyone today, we will follow up with you after the event. Lastly, please know this program is being recorded and will be available for viewing on campaignforaction.org within a week. With that, I think we're ready to get ready. Go, Sue.
Thanks, Suzanne. Thank you. And today we mark 10 years since we embarked on a journey together to advance the recommendations from the landmark report, The Future of Nursing, Leading Change, Advancing Health. With passion and purpose, we set out to strengthen nursing education, advance practice, improve the diversity of our workforce, and promote nursing leadership. And we've made tremendous progress thanks to all of you and so many around the United States and even globally. As we gather virtually today, we grieve for all the lives that have been lost to the COVID-19 pandemic and for our profession, which has been battered during this past year. Nurses have risen to the occasion to serve on the front lines and other administrative and policy roles to support those at the front lines. Nurses have given their all to patients and their families with courage, conviction, and compassion. Many have cared for multiple critically ill patients without adequate training or the equipment needed to keep them, their patients, or their loved ones safe. Many have been the only ones present when their patients died. Many have faced violence, and some have lost their jobs for speaking out about subpar conditions. Horrible. Nurses have witnessed an unprecedented behavioral health crisis that our country is only beginning to process. In short, nurses are exhausted. And we've all seen how the pandemic has laid bare the stark inequities that have persisted for generations. That's true in the nursing profession, too. As with the general U.S. population, nurses of color have been more likely to get sick and die from this virus. In the midst of so much suffering and loss, we pause for a moment of grace to remember and honor those who have lost their lives during this pandemic, those who grieve for their loved ones, and those who care for the sick, dying, and grieving still. We take a moment, too, for strength that we might work together to create a better future for all. The COVID-19 pandemic must serve as a catalyst for creating a more just world. Never again can we be as unprepared for a pandemic, and never again can we expect our healthcare workforce to do so much with so little. Never again can we permit health disparities to persist. The future of nursing during the next 10 years must be about meeting the well-being of nurses and advancing health equity. To guide the nursing field, the National Academy of Medicine will release in May, I hope during Nurses Week, a second Future of Nursing report. The report will guide our profession in helping our nation build a culture of health, reduce health disparities, and improve the health and well-being of the United States population in the 21st century. It will incorporate lessons from the pandemic. Many of you have been with us since the beginning, and you've given your all to improve health through nursing. We invite you to continue this journey with us so that we can address the most pressing challenges of our time. We need you more than ever. In looking to the future, it is helpful to look back at the past 10 years to understand the progress that we've made in building the capacity of the nursing workforce. Progress that we've made because of your passion and purpose, and we're still building that capacity. It is with great pleasure and pride that I turn things over to my dear friend and colleague, Dr. Susan Reinhart. Susan?
Thanks, Sue. I hope you know that working together on this decade-long project has been a great pleasure for me as well, and I look forward to our continued collaboration in shaping the future of nursing. As the leader of the AARP Public Policy Institute, I am especially concerned about nursing's capacity to meet the healthcare needs of older adults. We have to do more to ensure nurses are prepared to care for an older population and support family caregivers while also addressing the social determinants that affect the health of all Americans. AARP is committed to this work and to partnering with the nation's 4 million nurses and a wide range of other stakeholders. We have found allies in business, government, and academia, in social justice and consumer organizations, and in the other health professions, all of whom understand the valuable role that nursing plays in achieving health equity, the preeminent challenge before us. We've already made tremendous progress following the recommendations of the 2010 Future of Nursing report. 10 states have fully modernized laws that prevented nurse practitioners from providing care to the full extent of their education and training. An additional 8 states, including big states like California and Florida, have made substantial improvements to increase consumers' access to care. In 23 states and the District of Columbia, nurse practitioners are allowed to provide full care. In response to the COVID-19 pandemic, 7 states, Kansas, Louisiana, Massachusetts, New Jersey, New York, Virginia, and Wisconsin, have temporarily provided full practice authority to nurse practitioners. Even with these changes, more than 260 million Americans, that is over 75% of our population, still lack direct access to care. Nursing education has been transformed to ensure a better prepared profession, from more nurses graduating with their Bachelor of Science in Nursing to strengthening population health in the nursing school curriculum. We've also created pathways and programs to diversify the nursing workforce so that one day it will reflect the population in which it serves. And we've encouraged nurses to lead. At the start of this year, we counted 10,000 nurses serving on boards, influencing policy from the local school district to multi-state health systems. We can and will build on these achievements as we prepare to tackle the work that lies ahead. Among the many realities the pandemic has laid bare, one jumps out at me. As someone who views the world through the lens of nursing, policy, and older populations, I have long believed that the future of nurses and the future of our nation's older adults are completely linked. I hope this is now apparent to everyone. Sometimes we focus so hard on what nurses can do for others that we forget to focus on what others must do for them. Nurses are a precious resource that we must preserve and protect. In the past year, we learned just how vulnerable frontline nurses can be when the systems are not in place to protect them during a crisis. Moving forward, we must do more to ensure nurses' well-being as we work equally hard to protect older adults and other vulnerable populations. Caring for COVID-19 patients has pushed far too many nurses to the brink. But remarkably, the pandemic has also created opportunities. Nurses are playing more leadership roles in clinical environments and pioneering care practices that are helping patients survive and families cope with loss. Meanwhile, the removal of regulatory practice barriers is allowing advanced practice nurses to provide access to care for ever more patients using telehealth. These developments affirm what the campaign has been saying about nurses all along. They are essential to creating a nation in which the ability to lead a healthy life and access to high-quality care are available to everyone. Today, we'll revisit the progress we've made in partnership with all of you. We'll also get a glimpse at where we're headed. I'm confident you'll leave today's summit as eager as I am to remain engaged in the important work that awaits us. Sue?
Thank you, Susan. Now it is my great privilege to introduce our panel, which will reflect on the many challenges that nurses have faced this past year and how the pandemic has laid bare the systemic inequities in our health system. The panel will also highlight how the Future of Nursing Campaign for Action has helped to prepare more nurses to take on leading and collaborating roles in advancing health equity, the most salient issue of this decade. Dr. Richard Besser has been the president and CEO of the Robert Wood Johnson Foundation since April 2017. His role at RWJF, as well as his previous positions as the former acting director for the Centers for Disease Control and Prevention and former chief health and medical editor at ABC News, has made him a leading voice in prioritizing the needs of those most impacted by the pandemic. Dr. Besser speaks prominently about the importance of health equity, advocating for racial justice, full inclusion of people with disabilities, and a just COVID-19 response and recovery. He will be joined by Dr. Linda Burns-Bolton, the Senior Vice President and Chief Health Equity Officer at Cedars-Sinai Medical Center in Los Angeles, an American Academy of Nursing living legend, an RWJF trustee, and the vice chair of the IOM committee that released the first report, The Future of Nursing, Leading Change, Advancing Health. Over a career spanning more than 4 decades, Dr. Burns-Bolton has impacted healthcare policy, clinical practice, and patient care nationally while elevating the role and enhancing the professional training of nurses. She has spent her career advancing health equity and epitomizes the Maya Angelou quote that a hero is any person intent on making this a better place for all people. Michelle Larkin, the Associate Executive Vice President at the Robert Wood Johnson Foundation and a former oncology nurse, will serve as the facilitator. Ms. Larkin is a leader in health policy and practice and an attorney committed to using law and policy to improve health. She provides leadership to the executive vice president, senior management team, and staff on strategy and all programs, policy, communications, research, evaluation, and learning activities. In this role, she helps shape the foundation's vision to build a culture of health in America, where everyone has a fair and just opportunity for health and well-being. Please join me in welcoming our distinguished panel.
Hello, everyone, and welcome. Thank you so much to Sue and Susan for welcoming us. It's a pleasure to be here with Rich and Linda for today's discussion. And we're going to jump right in. First of all, we can't start this conversation without talking about the pandemic. It's hard to believe that a year ago we were just getting a sense of what the next 12 months were going to look like. And I think we're still holding our breath for what the next several months look like. And while this year has been a reckoning for all of us, what's one thing that has really stood out for you two on both a personal and professional level? And Linda, I'd like to start with you.
Well, it has been so difficult for our nurses here at Cedars-Sinai Medical Center in Los Angeles, struggling to balance the daily challenges they have of providing excellent care to everyone who chooses Cedars-Sinai to receive their care, and same time trying to support their families. And so that balance act is one that many members of the health professions find themselves doing. How do I give of myself and try to work with a variety of people to improve health for all? And how do I make myself available to my family? So that's been the struggle, and we're pleased to say that Cedars-Sinai has stepped up to the plate and is doing a great deal of work with its workforce and with its community to achieve those goals.
Great, thanks. Rich?
Well, first, I just want to say it's such a privilege and an honor to be here in conversation with the two of you, two amazing nurse leaders, and to have an opportunity to speak to an incredible audience from around the world that includes some of our world's leading nurse leaders. When I reflect back on this year, it has been just an incredible year in so many ways. To see our nation go from where we were last January to a total change in society. The devastation of the pandemic itself, the economic crisis, and the movement for racial justice have really led to a moment where we are challenging so many aspects of how we think about healthcare, how we think about health and society. For us as a foundation, it's led us to look at our work. We've been focused on building a culture of health in America for many years, and that's a recognition that health is about more than healthcare. What this year has led us as a foundation to reflect on so acutely are the barriers that so many people face, barriers due to structural racism, barriers due to classism and economic challenges. And it's led us to think about what we do in new ways. And, as devastating as the year has been, I think it provides us all with opportunities to think about what kinds of changes we want to see in society, what kind of changes we want to see in our healthcare system, so that we end up in a situation where truly everyone has a fair and just opportunity for health and well-being. And that's what we mean by health equity. And I think that nurses play a critical role in this, both as witnesses and participants to what took place over this past year, but also as leading researchers and voices and leaders around the table as we work towards change.
Thanks, Rich and Linda. Your reflections are so important, and I think really touch on some of the reflections that I've had as a nurse, and thinking about all of my nurse colleagues who are working in multiple settings, sacrificing time with their families, and doing what they can do and what nurses do all the time, which is bring passion to the care of people, and thinking about how we as a profession can really lean in and address, Rich, some of those inequities that you have articulated. It's really a critical time for us to think about what comes next for us as a nursing profession, and how we go from being an unseen, always there, to being seen and heard and playing really important, critical roles in decision making, which is what today's conversation is really all about. So we're still in the thick of the pandemic, but with vaccines being rolled out, and hopefully we'll see them rolling faster and faster as we get farther into it, could you both reflect on the lessons to be learned about health equity and our healthcare systems that we've learned from the pandemic, recognizing that we're still learning as we go, but up until this point? And Rich, I'd love to start with you on that question.
Yeah, Michelle, I spent a number of years leading emergency preparedness and response at the CDC, and I was always very wary about the phrase lessons learned, because what I tended to see was that things were observed, but very little, if anything, was learned, because the next time a crisis came, we were in the exact same position we were. And there are a lot of things that we can learn here. I'm not seeing as much learning in real time as I'd like to see. For instance, right now with the vaccine distribution, I think I've never been more cautiously optimistic during this pandemic than I am now with 2 approved vaccines, another one under consideration, the numbers of doses going up, the number of cases of COVID going down, the number of hospitalizations and deaths going down. That's all terrific. But when you look at the trajectory and the impact of the pandemic, well, every community has been hit hard. Black, Latino, Native Americans have been hit the hardest in terms of cases, deaths, hospitalizations, economic impact. And when you look at how the vaccination distribution and administration has been rolling out, you see a far greater proportion of vaccines going to white people than to the groups that have been hit the hardest. And that tells me there's a lesson there that hasn't been learned. And it's a lesson of equity, and it's a recognition that different individuals will need more or less assistance in getting vaccinated. Individuals who are going to work every day, who are driving the bus, or police or fire, or working in the supermarket or food production. If you're not taking the extra step to make it easy to get vaccinated, you're not going to be reaching some of the groups that have been hit incredibly hard. Teachers, another group that needs to be in there. The first group that were vaccinated, healthcare workers and those in long-term care facilities and those working there, that was great. That was the recommendation of CDC. But the next group that was to get this was essential workers. And the reason that the advisory committee to the CDC said to do that was that a disproportionate percentage of people who have to leave their house every day to work are people of color. And those were the groups that were getting hit the hardest. But most states have abandoned that. They haven't learned the lesson of equity here when it comes to vaccine distribution. So we're seeing a disproportionate allocation of vaccine to some individuals who are at lower risk. And that I find to be very concerning. It's something we can still change. It will take work to change. There's a lot that's put out there that it's due to vaccine hesitancy, and I don't buy that, because the majority of people of all races and ethnicities want to get vaccinated, and if we make it easier for people to do so, we will see the numbers going up.
Yeah, and I just like to build on that. The idea that we are still afraid of what the country might do to African Americans and Native Americans and Hispanic people is ridiculous. And I'm not saying that it's perfect, but we need to open the doors wider to assure that everyone has equal access to that vaccine. And there are individual parts of this country where it's very difficult to get to. And, I come back to something that I've spoken a lot about, frontier nurses. They're the ones who are going out there giving those immunizations. And we need to invest in more public health nurses being able to get out and give the vaccine. At the same time, we need to engage in our community partners in efforts to educate the larger community about why getting inoculated is so important. It's important for all, not just old folks. It's important for everyone. And it means that we have to, take off our badges and get out there into the general community to be of use to others. We're in the human caring business. We care about humans. And so we want all humans to have the potential to be as safe as possible. And that includes getting them all inoculated.
Yeah, it's such an important point, Linda, to think about how we actually get out into community and make sure that they're hearing from people that they trust, people that they can say, that person has the same lived experience as I do, and they went and got this vaccine, I need to, and making it easier for people from different languages, from different cultures to be able to access the vaccine system. I think it raises a larger issue too that we still haven't solved in this country, which we have a large number of people who are uninsured. And while that's not tied to whether or not you can get a vaccine, you can get a vaccine whether you have insurance or not. But getting the care that you need if you are to get sick, for me, that was one of the areas that when I think about a lesson to be learned, to your points, Rich, that's a lesson that we still haven't learned in this country, that perhaps relying almost exclusively on whether or not you have health insurance tied to employment is not the way to go when you think about essential workers and the people that we relied on during the pandemic to really help us continue to survive as a nation. It's an area that we need to continue to look at as we think about inequities and our healthcare system. I want to continue to talk about the lessons that we are learning, that we need to learn from the pandemic, particularly about how it didn't impact everyone in our nation equally. You've both touched on that in your previous responses, and it's had a particular impact on nurses that hasn't impacted nurses in the same way as other professions. So as you think about what needs to come next, as we think about the campaign for nursing and campaign for action and nursing's role in it, why is it so important for nurses specifically to engage in taking action to address health equity and to advance health equity more importantly?
Well, they're the most trusted professions. I mean, other than, when we had the New York event, as I call it, they have always been identified as the most trusted individuals by the general public. And therefore, we need to invest in them and make sure that they have the capacity to deliver the best possible care wherever they are, whether they be frontier nurses, ICU nurses, OR nurses, all nurses need to have the capacity to be able to deliver care to all people. Now, that is a question that continues to harm us. Are we as equitable as we possibly can be? And I know Dr. Besser can speak to this. We are not as equitable as we think we are, and it's very, very difficult to not have health equity as a key and central focus for the work that we need to do. We're never going to be able to get the trust of Americans without making sure that everyone has equal access to health services and everyone is provided that access with regard to whom they are. So you don't do the same for the 95-year-old Jewish woman who lives in New York as you do for the 90-year-old Californian, because they come from two different experiences. And so you do need to be able to address people where they are and focus on what their needs are, including what their needs are for information, so that they can trust the system to be able to deliver the best possible care.
Thanks, Linda. Rich, I'd love to hear from you on why you think it's so important for nurses to engage in addressing and advancing health equity.
I think it would be an incredible loss if nurses weren't addressing issues of health equity. Nurses during this pandemic and before have been witnesses to the consequences of an inequitable society. In being providers of frontline healthcare, they've seen the disparate allocation of diseases, the disparate toll this pandemic has taken on people by race, by class, by geographic location. Nurses have also experienced the inequities. If you look in this pandemic, there have been hundreds of nurses, unfortunately, who've lost their lives to COVID. And that toll has disproportionately impacted nurses who are of color. And so looking to see why is that? What is it that has led to that inequitable impact? And if you look in particular at Filipino nurses, have probably the highest death toll of any employment group in the nation.
Right.
So you have to ask why, and then work towards addressing that. And I think, Linda raised an important point. You did as well, Michelle, about who is trusted in communities. And as we think about the issues of vaccine hesitancy and addressing people's concerns, I've listened to a number of programs that have been put on largely by Black health groups that are working to try and address concerns. Last night, one that was put on by Rutgers University in Camden, led by a terrific nurse leader at the university. And it was a way of providing clear science-based information by trusted voices.
Mhm.
And that's so important. That's one of the things that's come through in all of the surveys around hesitancy, that people want clear information and they want it from voices they trust. And given that nurses are such a trusted segment of society, having nurses out in making the case for vaccination and respecting people's experiences. The reason that people have different takes on vaccine and on science has a lot to do with their own lived experiences. And we've seen, as you know, in our surveys of discrimination, the high rates of self-reported discrimination among people of color in America, discrimination, disrespect by the healthcare system that has led some people, many people, to not take at face value what's coming forward and wanting to know more, wanting to have their concerns addressed. Nurses play such an important role in that, as well as being at the table when strategies are being developed because of the experience they have as nurses and as individuals who also have experienced inequities.
Yes, and it's so important that we work to increase the footprint of nurses. Nurses, most people think of a nurse as in an acute care setting, but there are many more nurses out there in community. And, public health nursing is an example. What a wonderful group of professionals. And there are a lot of ethnic nurses of color in the public health ranks, but they're not seen as the go-to person, and they are the go-to person. They are in their churches, they're in their schools. And so we need to promote having nurses speak up about what can be done, what should be done, and why it's important to every different individual. I remember a story about grandma's hands, and and I can hear that song in my head. And it is important that every single person in the community recognize that the death of one is the death of all. And so the number of nurses, unfortunately, who have died, the number of suicides that are up among health professionals, and especially among African American and Latino, is quite significant. So we must call the circle. We must engage everyone where they are and try to communicate effectively why it's so important that they be vaccinated, why it's so important that we speak to and demand health care for all, and why it's so important that we, as knowledgeable persons, get out there and speak up for those who don't have the knowledge about the impact of this pandemic, but there'll be more pandemics, and we need to have the most knowledgeable and capable people speaking up for all.
That's right. I mean, I think part of it too is we need people speaking up for what comes post-pandemic, right?
Yes.
Because we're seeing so many inequities, not only in how care is provided, vaccine access, but also when we think about previous disasters that we've experienced as a country, mental health services and behavioral health. And Linda, you just touched on that a little bit. That is something that I'm hearing from my nurse friends and colleagues and family is, the grief, the trauma that they're dealing with, the impacts that it's having on how they think about showing up at work in their long-term care facility or public health or acute care settings. I think there's real opportunities for nurses to lean into that and think about how we open those up in a way that it is equitable and it doesn't matter who you are, how much you make, the color of your skin, that you can actually get the care you need from people who understand and have a passion. It's why we all went into nursing, is because we're taking care of people and we want to help them be better. And it's not just the medical side of things of providing medication, but truly caring for the patient and their families. And it still speaks to my heart, even 30 years after I made the decision to go into the profession. I want to probe a little bit more for both of you on your thoughts about nursing and nursing's role. This was WHO in 2020 had designated it the year of the nurse and the midwife. It certainly did become the year of the nurse, but not in a celebratory way. It became much more about being the heroes on the front line and being more visible than perhaps ever before. And in a way that certainly we would not have chosen as a profession, in terms of having to make the difficult decisions that have been forced upon us through the pandemic. So as you think about that, and Rich, to your point, what are the lessons to be learned that we should be taking from this, Linda and Rich, as you think about that? Linda, I'm going to go to you first, because I know you've been thinking about this as you think about Cedars-Sinai and how to actually apply those lessons learned to the nurses in your facilities.
Yes, so Cedars-Sinai is fortunate that that it was able to provide care to so many patients who were our highest number of patients we had at any one time was 350 individuals with suspected or confirmed COVID. Can you imagine that? And providing the care for those individuals and their loved ones, and seeing their loved ones not being able to come up to the institution and be at their person's bedside. And who was the one group who communicated with them? The registered nurse. So nursing has always been there and will remain being there. It's not just about flow. It's not just about Florence Nightingale and her lamp and going around. It is about human caring. We're in the business of human caring, and we do everything we can for those who trust us with their lives. Those who don't trust us with their lives, you don't know the number of nurses that I have had to support in saying, don't worry about what that family member said in terms of not blessing you for the work that you're doing. I bless you, And it's important that we continue to support those who are on the front line, whether they be nurses, janitors, social workers, physicians, everyone who's on the front line providing care. It's extremely important that we say thank you to them always, and that we support them in everything that they can do to advance themselves. So I'm a big proponent of advanced education and have been supporting that throughout my professional career. It is important that we get more nurses educated at the minimum at the baccalaureate degree level, and we made it. We did it in terms of the success and future of nursing report helped to do that, because it egged us on to try to increase the number of nurses with baccalaureate degrees and higher. We have had so many programs to be able to support nurses as members of the healthcare team. And I want to emphasize the word team, because it does take a team. It's not just one single profession. So the future of nursing is about nursing being thanked and supported and for their efforts, but working as a part of a collective team.
That's great. And Rich, I'd love to hear your perspective, and I hope it's all right to put you on the spot here. I'm really curious, as you think about the public health system and nurses' role in that, where do you see nurses leaning in? I think in many ways it's similar to what Linda just talked about, but I'd love your perspective on that.
Yeah, I think first off, the impact of the future of nursing activities and the Campaign for Action has just been incredible, with more states moving to allow nurses to practice to the full extent of their license. Mm-hmm. So nurses with advanced training. I think back to my own training and career as a pediatrician, and the work that early on I did with pediatric nurse practitioners, and how much I learned from them. And currently I work as a volunteer pediatrician with a pediatric nurse practitioner and other nurses. And it's absolutely terrific. I see nurses as a critical part of the healthcare team. But when I think about nursing, just to share a story, I think many of us have a little voice in our ear that talks to us and lets us know whether we're doing the right thing, whether we're on target when we've got those hard decisions. And my voice in my ear is my grandmother. my grandmother was a Jewish immigrant from Russia. She came over as a toddler, and she got a scholarship to go to nursing school in Philadelphia. And on the ward, she met the man who would be my grandfather, and they practiced in Philadelphia for 50, 60 years. And one of the things about her that has stuck with me and has helped guide my approach to health and what people in the health profession do is that she saw being a nurse as yes, taking care of patients, but much more than that. She saw it as being an advocate for people in the community. And I remember I used to ride my bike. I went to med school in Philly. I would ride my bike out to their apartment, and she would be sitting there yelling at the television. She'd be watching Washington Week in Review. She'd be yelling at the television, and then she'd get out her pen and she'd start writing letters. And I think that that's a critical piece of nursing. It's advocacy because of the position of trust, because of the lived experience. Nurses' opinions carry a lot of weight. And one of the things that we've seen with the future of nursing work is more nurses at the table in boardrooms, and that's really, really important. More nurses with advanced training. But it's also nurses embracing that role of community change agent that I think is really, really exciting and gives me a lot of hope for the future.
Thanks. Linda, I wanted to just follow up. I've been watching the chat, and one of the questions that came up was around ADN programs, and there still being many ADN programs out there, and ADNs are not going to go back for BSNs. It's an assumption, and with the current demand for nursing. Do you see that assumption holding, and how do you see us getting to the place where we have more baccalaureate and people who are ready to meet the complex needs of our patient population and their families?
Right. And so, we still have some diploma schools in the United States of America, believe it or not anywhere else in the world, but in the United States of America. So we have 3 different tracks for individuals to become registered nurses and get licensed in this country. I still believe and have hope that the schools will join, like they have in various parts across the nation, where associate art degree programs have joined with baccalaureate degree programs. So you might enter as an associate art degree student and then transfer into a baccalaureate degree program. That's the greatest hope that we have, because we're not going to close down associate art degree schools because we need nurses. So how do we make the transitions and make the transitions easier for nurses to practice at the top of their license, nurses to enter nursing as either master's entry into clinical nursing, which we've seen those MECN programs grow tremendously, or to complete nursing programs. So when you get out of nursing school, as a person who has asthma, I'm in my pulmonologist's office often too much. And two of his individuals there are in nursing school. And I find out that they're in associate art degree school, and I say, why? And they say to me, because it's easier. Well, we don't want the easiest, we want the best. We demand the best. And so we need to have programs that are continuation programs like the Cal State system here in Los Angeles has done, where they've taken individuals from the associate art degree programs here in Greater LA and linked them to their baccalaureate programs so that they can graduate with a baccalaureate degree and be able to get licensed as a baccalaureate nurse. So the good news is the future of nursing has profiled a number of these different efforts across the country to create a track that does allow for associate degree nurses to complete their baccalaureate degree. And why a baccalaureate degree? Because we have data going back eons that nurses with baccalaureate degrees provide the highest level of professional care.
That's great. We have another question that I want to just touch on a little bit more, and it goes to this education piece that I think both of you can provide insights into. I'm going to start with you, Linda. which is really about what should we be doing for nursing students to get them ready, better prepared to address inequities, to address those things that the pandemic have really shown the light on. They've been there forever, persisted, continue to persist. But what should we be doing to prepare our students? You talked a little bit about working in teams and being ready to be there, increasing the education level, but would love to hear more from both of you about, as you think about public health, community nursing, thinking about people who serve their religious communities as a nurse, parish nurses. What does that look like in terms of educating our students and getting them best prepared?
Well, so I think that students need to be educated in where people live, work, play, and go to school. And so they should be educated, and we should have a system of education that allows those nursing students to go spend some time with the school nurse, go spend some time with the church nurse, go spend some time with the community health team who are out there doing the heavy lifting of human caring, and learn the importance, as Florence Nightingale did. She went out to the fields. She didn't stay in England. She went out to the fields to really learn about what does it take to be able to provide safe care to all. And that's really what we have to be about. And so I think we should blow up the traditional nursing education programs as they exist today. I read an article recently about the 3-year, the people are advocating for 3-year for the physicians instead of 4 years. And while that has merit, I think all health professionals, and I've been on a few IOM studies looking at preparing health professionals, whether they be nurses, dentists, social workers, or others, case managers, doctors, they all need to be embellished with the thought of, I'm preparing myself to be able to do human caring work. So what is that going to take? And who should I be exposed to? And what should be a part of that educational and learning program? And I think we need to blow it all up and perhaps think about starting all over again.
Rich?
Yeah, it's I think whether you're talking about nursing, you're talking about medicine, you're talking about any field within healthcare, it's critically important that people are trained not just about disease progression and pathology and how you treat and help restore someone to health, but really trained in the upstream, because we spend so much money in our country on treatment. And so little on prevention. And to truly understand prevention, you have to understand what the drivers are of good health and what the issues are in terms of ill health. And I know in the training that I had, we didn't talk about that. We didn't talk about the connections between a living wage and health, and housing and health, and access to good education. And the impact of structural racism on health. We might talk about, well, we need more screening programs. We need to get more supermarkets with produce into every community. But we didn't talk about, well, why are some people relegated to living in a community that doesn't have a supermarket? How do you create opportunity for people to be able to move to where opportunity is? And it's a question of how far upstream do you look if you truly believe everyone in our society should have a fair opportunity for health. And it means educating those people who are involved in healthcare to that, so that there's not this. We've had such a focus in our healthcare training on individual decision making, individual choice on health. And not nearly enough on the structural things that impact on people's health or illness. And I think until we do that, until we reframe that, we will always be chasing our tail, treating the outcomes of an inequitable system rather than helping people to lead their healthiest lives.
Yes, and it's so important that we address the social determinants of health. It's very important because as we look at it, those determinants are what causes the unequal treatment, and they also result in unequal outcomes. And so more African Americans dying, more people of color, period, dying, and we must go upstream and find out who's throwing the bodies in, instead of just always taking the bodies out and trying to help. So I agree with you, Rich. We must focus.
I agree with you both. And I think part of what we also need to do is we think about educating students in the caring professions broadly, including public health, physicians, nurses, respiratory therapists, nursing assistants. And it is to help people really also understand the role that diversity and the importance that diversity, equity, and inclusion provide for us. And it will allow us to, one, find better solutions because we're coming to them together, and be able to meet the needs and to help people understand how those pieces, the social determinants of health, working upstream, and what we actually do to the body when it is ill and needs to be taken care of, really comes all together. So thank you for that. We only have a few minutes left, so I want to ask you both a last question before we thank everyone. As we wrap up, I really would love to hear from you about what each of you sees as an opportunity that you want to share with nurses everywhere, a wish or a hope for the future of nursing as you think about it, and what we know we're going to need going into the future. So, Rich, I'm going to start with you on that one. A wish or a hope for nurses.
Well, I would say a wish and a hope is that nurses are fully seen, appreciated, and recognized. I know as a physician this past year how challenging a year it's been. Just the incredible work that nurses have done in situations that are almost unbearable. And the toll that this has taken. And I know how exhausted so many people in the nursing profession are. I hope that we are on the road towards this health crisis winding down. And I hope that in that, those in nursing are able to practice self-care and breathe and recover and regroup, because there's so much to be done. But my hope is that nurses feel the gratitude that we as a society feel for the profession and its importance and its ongoing potential.
I guess that would be my hope too, that everyone sees nursing as the profession that is committed to equity in human caring. Equity in human caring. It is something that we all should strive for, all professions, not just the healthcare professions. But human caring involves more than just one's health. One can be in good health and still have poor outcomes, believe it or not. So we have to have excellence in human caring and be able to embrace that fully, and all members of society to embrace that as a mechanism for us to truly get to a healthier world where all human beings have the equal right to get health and stay healthy.
That's great. My hope for the future of nursing is that we continue to be advocates for our profession, our patients and their families, and the communities that we're a part of. And my wish for all of you is that you stay safe and you continue to practice self-care so that you can continue to do the important work that you do. I want to thank you, Linda and Rich, for spending time with us today and for sharing your insights. It's been an incredibly powerful conversation, and I'm grateful that I could be a part of it. And I want to thank everyone who has spent the time with us today for joining us. I know it's a busy time, and making time for something like this is something that we should be appreciative of, and we are very much so. Thanks, Sue and Susan, for our opening and for leading this important work, and all of the staff for at the Campaign for Action who have gotten us to this place. And I'm looking forward to seeing what the next set of successes are for us as we continue to make progress together. So thank you all and have a great afternoon.
Thank you.
Hello again, Susan. It's good to see you again. That was an incredible panel. I just love seeing my colleagues up there, Rich Besser, Michelle Larkin, Linda Burns-Bolton. They really painted it. In some ways, it was sort of overwhelming at the beginning as they were talking about the pandemic. They talked about the everything that was going on and how our country has changed economically, socially, culturally. And Rich in particular talked about the lessons that we had to learn, but are we learning them? We're observing everything that's going on, but are we really learning the lessons that we need to learn? One of the other big things that I really took from this, Susan, was the voice of nursing. Linda Burns-Bolton talked about, they all did, they talked about advocacy, that we are the most trusted profession. And, we need to be advocates for our patients, for our families. And Linda in particular said, don't just do it at work, or at least this is what I heard her say, don't just do it at work. You have a whole community. You have schools that you're connected to and your faith community. Be an advocate no matter, your position in your community. So those are just some of the things that I took from that. What do you think?
Well, I was curious about who's on. I was looking at the chat as well in response to this conversation. And I don't know if you know this, but we had 1,700 people registered for this event, and they're from every state and DC. We have nurses, acute care, public health, trauma, emergency room, home health, academe, school nurses, hospice, and they're weighing in. As we were talking about this, I thought that was really interesting. We have deans and faculty and students and more than 20 different nursing organizations and 60 chief nursing officers. And I could go on and on, but I won't. But I did listen to some of the chat.
But what about the country, Susan? I heard that there were 11 countries represented on this call. Let's give a shout out to, of course, the United States of America, but Albania, Canada, Croatia, India, Lebanon, Lima, Peru, Pakistan, the Philippines, Saudi Arabia, South Korea, and the United Kingdom. And it's interesting. I'm so happy to have people from all over the globe listen in. And I think a lot of people know that the first Future of Nursing report has remained the #1 report out of the then Institute of Medicine, now National Academy of Medicine. And I remember in our second year, and we kept hearing #1 report, #1 report. And I went back to the stats, and it was because the report was taken globally. So we do have a global audience, and we're glad that so many of our colleagues from around the world are listening.
Great. So I was looking at some of the chat, and one of the areas of the conversation that really struck me was around this vaccine, the inequitable distribution of vaccines right now. Right. And that may be this moment in time, but as Rich said, we're not learning lessons, so what about the next time? But also the idea of why is there such an equitable distribution? This is something AARP, by the way, is tackling. We do have a campaign around vaccines. And this idea of hesitancy, if you look in the chat, I just wanted to read a few things that I was seeing that first of all, just that this inequitable distribution, Cynthia Samuel said, this is shameful. And then Martha Dawson said, it's not hesitancy, it's the worst case of political determinants. So there was, and then Alicia Georges weighed in, and it's just a lot of going on here. Like, we need to understand what's underneath all of this. That's what really came through. As Linda says, we're in the business of caring, the human business of caring. And how can we listen to what people are telling us? Rich made the point we need to understand people's stories. I love his story about his grandmother, by the way. I could just see her sitting outside and writing letters, getting everybody all excited about doing that, and teaching her grandson that this was really important to do. But that really came through, that we have to listen to people and understand so that we can act. And you brought up advocacy, right? So
advocacy is so important. And I think nurses are, you see it on TV and in some of the clips in the news, that nurses have a voice. Some people are getting in trouble for using their voice, but it really struck me that we need to be strong advocates in and outside of our jobs.
Absolutely. There's so much chatter going on that I couldn't even barely keep up with it. So my apologies that I couldn't tell everybody what they're saying, but keep it up, because this is what we have to do, express our opinions, and maybe we can make some of this available afterwards, at least a summary of some of this.
Yeah, Rich talked about hearing his grandmother in his ear. My mother was a nurse, and I hear her voice in my ear many times. I remember when she told me she went to Bellevue School of Nursing, and she passed away last year, but we had a lot of conversations about equity issues. And she told me when she went to Bellevue that she was taught by the chief mistress, the matron there, the chief nurse, I don't know that they call it the chief nurse, that she really expressed to all the students that everyone who walks into those Bellevue doors are equal, and everyone deserves equal and fair treatment. And that was, how many years ago was that? That was in the 40s. But what struck me these days too, we're so good in nursing school in particular, Susan, you'll know this too, that we were taught to be really colorblind, that we are to treat everybody equally. But that actually has been a hindrance as we have come to understand it now, to be colorblind, because we really are now being taught we've got to see color. We've got to see color to really understand the disparities and address them.
Right. I agree with that. And there's comments also in the chat about education came up, for example, and why are we teaching the same way as we did 40 years ago? I don't know if that's true. I used to be an educator. I'm not right now. But we do have to have significant change. I loved, Rich, you said nurses need to embrace the role of community change agent. I wrote that down. I'll be quoting that quite a bit in the future because I do believe that very strongly. And Michelle also, by the way, talked about this need for advocacy. And again, another thing that keeps coming out is our trusted, the idea that we are the most trusted profession and have been for decades now. And one concern I do have is, we have to make sure that nurses have the resources they need. I think Linda called it the capacity that they need to be trusted so that they can deliver the care that they know they want to give. So they can't just want to give it, they need the support to be able to give that. So I think of nursing when I like the what is your future, your hope, your wish, and I know that others
that was a great question, wasn't it?
Yeah, it was really good. I know others are answering that too, also in the chat. But I do.
And what is your hope and wish?
So my hope is that nurses can continue for decades to be the most trusted profession in our society, but that society understands this is a precious resource. I said that in my introductory remarks too, that you can't just expect this to keep happening. We have to make sure that we respect this precious resource for society and help nurses be able to deliver that on that promise of trust. So that's going to take a lot. And what about you?
Yeah, so I wanted to make a comment about the trust issue. I remember a number of years ago, this comes up every year, doesn't it? We're the number one on the trust hit parade, so to speak. And several years ago, I thought, well, here it is again. We're trusted. What does that really mean? And I remember when our former president, Dr. Risa Luisa Moret, was in her term at the foundation, she said, Sue, you shouldn't take that statement so lightly every year that you're the most trusted, because if we are truly going to make a difference in this country in terms of everyone having a fair and just chance at health and well-being, they need those trusted voices. There are people who feel very disenfranchised and feel like they're very, very left out of the conversation, left out of life, not just the conversation. And to know that there is a trusted being that's in your corner, that'll really make a big difference. And when I sort of got that into my head, my thick skull, I don't take that election that we are the most trusted every year so lightly. Mm-hmm. So you asked me what my hope and wish was or is. I would say, as you know, I'm working at the National Academy of Medicine on the next Future of Nursing report, which, by the way, has to do with the nurse's role in achieving health equity. So to be honest, because we're working so hard on this right now, that would be my wish and my hope, that every single nurse, and I don't just mean nurses in leadership positions or nursing in education, but every single nurse at the front lines in schools, in prisons, in faith communities, every single nurse, acute care, public health, that every nurse understands what those social determinants are and how they affect human beings and human families and communities, and they really are aware of that. and works on the resources to really address those determinants and, in essence, be a stronger voice for health equity in this country. And that's certainly my hope and wish after working on this report with a wonderful committee. That's my hope and my wish.
Great one. That's a great one. So I think we can have a little fun. Do you think some trivia?
Yeah.
Okay. So let me just see. I had some notes here. Let me just find them. So, by the way, if folks want to play along using, just go into the chat, as you clearly know how to do because there's so much of it. But, I think most people know by now that the nursing workforce is the largest part of the healthcare system. But how many nurses are there? Just to get that out there. What do you think? What do you think, Sue?
Well, I think I know. I think
4 million.
I know.
4 million.
4 million. There you go. 4 million. That's right. So here is another trivia question, Susan, for the audience. Who holds the honor of being the very first Black registered nurse?
Can you give some choices?
Is it Harriet Tubman, Estelle Massey Osborne, Mary Eliza Mahoney, or Mabel Keaton Stompers? We'll wait to see what people say. What do you think? Do you know this one?
Well, I do.
Well, you have the notes in front of you, of course. So, yes, the correct answer is Mary Eliza Mahoney. And she graduated in 1879 in honor of Black History Month. So let me share with you a little bit more about each of these women. Harriet Tubman provided nursing care, but she was not a registered nurse. Estelle Massey Osborne, yes, a nurse, and she was the first Black woman to earn a master's degree in nursing. Mabel Keaton Stompers, also a nurse and known for her advocacy for racial equality, which led to acceptance of all ethnicities in the United States Army and the American Nurses Association. There you go.
Wow, that's amazing. And talk about leadership when was this and what year are you talking about? It's quite a while ago.
Right.
So that's really good. But so here's another one. I think we have time for one more. Which poet also served as a nurse? This I didn't know. Emily Dickinson, Walt Whitman, Edgar Allan Poe, Edna St. Vincent Millay.
I've heard of this one. And I didn't even need my notes. I've heard of this one.
I think I knew this at one point. Walt Whitman. He served this nursing time in Washington, D.C. as a volunteer hospital nurse during the Civil War. So I think that's enough trivia for now because I do think we want to move on to our next panel.
Okay.
It's not really a panel. There are two very special guests joining us, and they'll tell us how their personal journeys led them to enter the nursing profession and put them on two very different career paths. Very interesting. You'll see intersections too. So Dr. Antonia, we know her as Tony Villarruel, co-chairs the Champion Strategic Advisory Committee that we created to guide our campaign vision. She'll tell us how she developed a passion for research and policy that led her to become a professor and ultimately the Margaret Bond Simon Dean of Nursing at the University of Pennsylvania. We'll also hear from a nurse, Marcus Henderson, who manages a child and adolescent inpatient psychiatric unit at Fairmount Behavioral Health System in Philadelphia. He also serves, as you know, Sue, he serves as a member of the National Academy of Medicine's Committee on the Future of Nursing 2020 to 2030. So they're going to talk about their insights, joys, and challenges as they face their careers and share some advice for all of us for the future. So Tony and Marcus, let me turn it over to you. Take it away.
Well, thanks, Susan, for that great introduction. And Marcus, always great to see you. We want to have a conversation about everything that's transpired throughout this pandemic. And I think to share a little bit about our careers in nursing and our different pathways. So, when you think about the pandemic and some of the things that you've had to deal with, Tell me what's been the most surprising for you in terms of both challenges and both opportunities and also preparation in dealing with the pandemic.
Yeah, and that's I think, a great question. I think one of the most challenging pieces with the pandemic, as you know, I practice clinically as a psychiatric mental health nurse, is I've always understood the stigma that's been associated with mental illness and the lack of acceptance among patients and families when they're faced with a mental health issue. But I didn't really realize the extent of it until the pandemic, in the sorts that inevitably this pandemic's affecting everybody's mental health and well-being in some way, shape, or form. And I think that's also the positive, in that there's more open dialogue and conversation about the impact of mental health on individuals and families, especially healthcare workers who historically have taken on the burden of their patients and their families, but even more so now. So I think it's brought to light the extent of that issue, but also kind of where we're headed. Maybe people will have more of an appreciation for the work that people do in my specialty, is something I think is positive.
Great. And so, we've also been dealing with another pandemic, not just the COVID, but also what I'll call our reawakening or recognition, not just of structural racism, but the white supremacy as well. So tell me how that's affected your practice, your outlook, and what you've been thinking about.
Yeah, it has certainly has changed the lens that I see my practice, and I'm sure, especially in nursing education, I see the lens changing, and I'd be curious to hear your thoughts as a dean as well. But for me, I'm biracial. My mother is white and my dad's Black, so I've always grown up kind of straddling both worlds. And it really wasn't until I had an experience in the hospital where someone looked at me and assumed, because of the color of my skin, that I was white, and had the audacity to talk about their prejudices and their racist comments towards the people that I work with every day, taking care of people in the hospital. And it was this reignited fire as to the importance of acknowledging, calling out, and having open dialogue about how the issues of racism and discrimination just plague communities across this nation. And I'm beginning to see students, I teach nursing students in community health and psych mental health, and there's a greater interest, and students are beginning to realize the connections that this has to health. So I don't know what your thoughts are, perhaps what you're seeing, and what challenges we're seeing in education related to that.
Yeah, I have to ask you first, though, how did you respond to this person who made that comment to you?
I'm going to tell you, I didn't know how to respond, because that was the first time in my life that I experienced that. And for me, I just reassured that parent, your child is safe here. Your child is actually on the unit interacting with all of our children and all of our staff with no issue. Just trying to reinforce that you have this false belief that your child's in danger because he's surrounded by Black staff members and other Black patients, but he's not. He's being a normal child, engaging appropriately with his peers. So it's really just providing that reassurance that there's no need to let race bother you and how your child's getting care. But I think my response would be, I don't even know what my response would be today, if I was being honest with you, because it's still something that's new for me.
Well, I want to just say that that's really impressive. I mean, you took the focus out of yourself and whatever reaction you had to really hear what the patient family were saying in relation to what their concerns were. So I'm not sure there is a good playbook for how to respond to those. And that's why I was so interested, because I think we learn from each other. So the issues of racism in racism period, and the racism in nursing and structural racism are nothing new. And there certainly have been champions that have been trying to address this structurally, personally, interpersonally, on the national level, at the system level, et cetera. What I see as being different is almost, and I want to say a reawakening, or maybe it's a realization of others who are not Black and brown, indigenous, that this is something that's real. And while they may not experience the same types of interactions or understand what that means, I think there's an acknowledgement that, yes, it exists, and yes, we need to do something. So there's, to me, I think there's a, again, a reawakening, or I said awakening of, again, needing to address this in multiple levels. So I think there's a lot of complexity, but I think we're asking the right questions, and at least we don't have to convince people that this is a real issue. I think, again, not only the killings of George Floyd, Breonna Taylor, on, was one example, but I think the issues of white supremacy that were so evident on January 6th, I think is a wake-up call for all of us.
Mm-hmm.
So, Marcus, given where we're at in the pandemic, and you shared maybe just a little bit about your, personal journey around dealing with issues of racism, can you talk a little bit about what got you into nursing and where you are now, and maybe is where you are now where you thought you'd be when you started nursing? And, what do we make of that?
I think for most people, where they say they want to be when they start nursing school is not where they wind up being. And for me, that experience was rooted in being the primary caregiver for my great-grandmother and great-aunt growing up. Both had Alzheimer's, and my aunt had Down syndrome. So having our own little hospital in our living room and seeing the nurses come into the home and their compassion, their respect, and their attention to the dignity of my family and making sure they maintain the best quality of life that they could. And that's what drew me into nursing, the proximity that we have to patients and families, our position within the healthcare system. And what I've come to learn is also our proximity to the community. And that's really what I've fallen in love with. Throughout nursing school, always thought I'd be a gero nurse practitioner. Totally did not go that route. Graduated nursing school with the engagement prize and started working in a homeless shelter in the community to really begin understanding the extent at which some of our most vulnerable are mistreated and not provided that quality of care, which has now led me to psych mental health nursing. So certainly not the journey that I thought, but I think my training and experience in public health and psych mental health has certainly prepared me for a pandemic. I mean, I didn't graduate school saying I'm ready to work in a pandemic, but I think those two specialties lend themselves particularly well for the skills that a nurse and a healthcare provider needs to navigate the issues of a pandemic from a mental health and well-being perspective, and how our community is doing during this time. So how about you? Did you think?
Well, I was going to say, and your journey is not yet done. So I think for, my career was a bit different. So, I am first generation. I grew up in a Latino household and community with 3 brothers. Talk about gender inequities, but my parents always made sure that we knew that we were always going to go to college. And so, my brothers could, go to liberal arts college and, go and be brilliant. But my parents wanted me to make sure that I had a good job. So it's like, yeah, you can go to college to be a teacher or a nurse. So I always say I made the informed decision of a 6th grader to say, yeah, okay, I think I'll be a nurse, and not having any sorts of experiences in the healthcare field like you did. But once in nursing school, I'm telling you, I fell in love with just about everything that I did, except one thing. I said, I will never, ever be a researcher, never. And of course, that's the first thing that I ended up, not the first thing, but that's what I certainly found a lot of excitement and found one of my passions. But I think, like you, what I found in nursing was a way to engage with communities and people in a way that other people couldn't. I mean, so you have the profession of nursing, and then one of my first jobs was working in a migrant camp, where I was the only bilingual professional there. And as like a 21-year-old, I had authority, I had lots of power, and I like that. But people depended on me, to tell them the truth, to help them work through their issues, to help them navigate the greater community, and to be their advocates. And that I found really fulfilling. It took a while before I could find another place or another area in nursing where I could do that. But it was through research. That was community engaged, community informed, setting aside what I thought my priorities were or what my interests were, to really shifting those to addressing an issue that was important to the community. So, as you know, I mean, my research has not only been in developing interventions, but in disseminating interventions. And, I mean, as I mentioned, I like the power that I thought it has a 21-year-old. I certainly have been humbled by communities who don't care how many degrees I have, or who don't care where I'm from, because until I earn their trust, I'm just somebody else that comes in. So I love the balance of keeping things even. And I think, like you, and I'm going to shift to you in a minute, I've also found out that, again, the more education you have in nursing and other areas, the more tables you're able to sit at to really affect change. And certainly not only getting a PhD, but the credibility in the community, the professional networks I had gave me a unique position to amplify the voices of my community in national leadership positions, volunteer committees, the National Academy of Medicines, for example, but also in community-based organizations. So I think, again, there's my research, which to me, they're all blended. It's the research that, again, gives me the credibility, gives me the knowledge and the trust on both ends that allows me, I think, to be an effective advocate to make some of the system changes that we need. I have a sense also, Marcus, that you have also found that because I think you were active as a student nurse, and I think some of the positions that you have now in the American Nurses Association and on the Future of Nursing 2.0 report, I think also make good use of your talents and your passion. So tell me.
Yeah, I've been very fortunate to have held many leadership opportunities and, like you, be humbled by the people that I'm serving. I think one of the things I've learned in my professional experience is that, especially working with communities, is that the people you serve, the community you serve, are the experts. They are the teachers. They are here to tell us what their needs are and how we can best support them in their support to meet their goals and objectives. And I think that's been the most beautiful part for me, is the collaboration piece of how we can work together to achieve common goals. But in terms of my leadership role, something I've always been interested in ever since I was in high school. Being in professional organizations, I was state president of our Future Health Professionals chapter in high school. And then going into nursing school, I knew I wanted to be involved in the Student Nurses Association and NSNA. And running for the board and being in those leadership positions. And for me, it was always about in nursing school, it was how do we make this the best experience for nursing students? How do we ensure that nursing students' needs are met? And I think my passions in public health and psych mental health were particularly of important because a lot of students and friends of mine, felt as though they weren't getting enough education in those areas, that there wasn't enough emphasis placed on particularly community health and public health nursing. And in my roles in the student organization, I was able to say, let's take a pause. Students are interested in community public health. They want to take jobs in these settings. So stop telling us we have to do 2 years in med surg, because we don't. We can go and be effective nurses and advocates in our community. We're just thinking about issues a little bit differently. I don't need to be thinking about the task orientation of walking into a med-surg unit. I need to be thinking more at an individual and population level of how does this one person's experience impacted by the determinants when they walk out in their community and why they might be experiencing what they are. And that carried with me through my roles in ANA and the Future of Nursing Committee. Part of the reason why, I was selected was not only for my experience in public health and psych mental health, but was being the next generation nurse, the next generation nurse leader. And what does that look like? What do nurses today want from their education and from their professional groups? And I've been championing my specialties and before the pandemic, and the pandemic just gave me even more fuel to say, this is where we're headed. We were already going in that direction. And if this has taught us anything, it's that we need to focus on this more. And that's community public health and psych mental health, because that's how we're going to survive this post-pandemic world.
Well, I think that's really interesting that you share that when what has been of concern to a lot of our students during this pandemic is not having enough patient exposure and not enough time to master, the tasks that they might do, the sexy things like, gosh, why can't we learn how to put an IV in anymore? Because that's not a skill that you need as an entry-level person. But there's still perhaps a sense of, if I don't master these tasks, then I'm not a good nurse. And I think you just confirmed that. And what I believe throughout my professional career is that the skills that we have in terms of listening, our goal, identifying a problem, figuring out a plan, reevaluating it, communicating, those are the skills that we have as nurses that we learn well in school and that carry us in whatever setting that we're in. And that really is the essence, I think, of what makes us different and what makes us special and what makes us valued during this pandemic and beyond. Mm-hmm. So Marcus, what do you think the future holds for nursing? What's your biggest wish, having lived through nursing school before a pandemic, having practiced in a pandemic? Where do you see the future of nursing, and what advice would you have for people who are thinking about, or maybe who are not thinking about, a career in nursing?
Mm-hmm. I think one of the things that has always surprised me is that we have a profession of over 4 million individuals who carry the honor of being a registered nurse wherever they might live and wherever they might practice. But we've never, in my opinion, have realized our worth. That's a pretty large number. And if we come together, we can really do a lot of good change in our local communities and in the nation. And I think one thing that this pandemic has told us is that we already knew nurses were vital to the healthcare system and healthcare delivery. We know that even more so today. We couldn't do any of the things that we do, like put vaccinations in people's arms, without a nurse in a community that's able to do that. So I think one of the things is that people just need to know their worth, need to know the worth of nursing and advocate and find their voice. I was able to find my voice at a young age. But now what I do, now that I know that I have a voice, I try to amplify the voices of others. And I don't think we've done that well in nursing. Bring up our peers and bring up others with us and amplify the greater voice of the profession. And I think we now have the opportunity to do that, especially when it comes to racial and social justice. Again, 4 million nurses in communities across this country. And if we really collectively come together to recognize it's a problem, to clean our own house, and be intentional on how we move forward, I don't see how we can't move the needle there. Sure, there's structural issues, policies and laws and things that are in place that do that, but we're seeing more and more nurses get in positions where they can change that. And they bring with them, like you say, that unique skill set of listening, of diagnosing a problem, triaging that, and developing a plan and evaluating. So I think we're going to see more nurses in critical leadership roles in the future, because now the world knows the power of nursing. The pandemic has certainly shed light on that.
Yeah, there's so many things that I agree with you in that sense. Number one is taking the opportunity that we have as a result of people recognizing the worth of nursing. And what I would hope that we're able to communicate is not just that we're compassionate and that we're brave, which are all important, but we have heads. We are thinkers, we are problem solvers, we are innovators, we can bring people together, and those are the skills that need to be amplified. So we need to advocate not only, gosh, you need to have a nurse on that task force, but you need someone who has X, Y, and Z, and this nurse is the person to do that. So again, as you were talking about pushing or elevating those that we know have those skills and abilities to do that. The second thing, I do think that we need to be strategic about those opportunities that we want to make sure we continue to push. As you know, there's been a lot of relaxing of regulations because the world, our health, because our communities need practitioners who can practice to their full scope. And I think this has allowed many states, the pandemic, to say, all hands on deck. And we need to be able to move that forward and make sure that those changes are sustained. Within our own profession, we need to give it up. There's some things that we absolutely need to give up, things that perhaps were not very useful in our past, things that we never had evidence for, and to, again, rework ourselves so that we can truly be addressing the needs of what our communities have, and whether that's taking a look at how we address racism in the curriculum, whether it's an issue of looking at the content that we teach, whether it's again from our regulatory agencies, thinking about what are the requirements to certify advanced practice nurses. There's lots of questions in what we do, and we have to be introspective of that, but with the focus of how is this going to help us better serve our patients, families, and communities moving forward. So we have work to do. I absolutely believe that we're up to the task, and I'm so excited to always to engage in conversations with you, Marcus, because it gives me great hope for our future. So thank you.
Well, thank you. It's always a joy and a pleasure talking with you as well. Being that inspiration for what a nurse leader looks like and how and inspiring others to take on that role. So you certainly are a role model within the profession and within our community, because people see themselves when they see you. They think, wow, I can be something. And that's what we need to be for a lot of people. I was a first generation student, single parent household, and I didn't have those people to look up to. And so that's very important to me, the mentorship and being, as Gandhi says, being the change you want to see in the world. And that's what's important to me too, is making sure that those that come after me have the same opportunities, if not more, that afforded to them. So I thank you for being that shining example as well.
Well, thanks, Marcus.
What a great conversation. Thank you, Tony and Marcus, for sharing your nursing journeys. Now, I want to introduce you to some new friends of mine on Christmas Eve with the help of a new organization that I'm involved with called Nurses Everywhere. The country musical duo Brown and Gray released an amazing tribute song for nurses called You Didn't Have to. They absolutely nailed it. How nurses bring their heart and soul to their work every single day and show courage, commitment, and expertise. Far too often, the contributions of nurses go unnoticed. This song showcases how nurses pour themselves into others, including making patients laugh, holding their hands, and praying for them. When I heard this song and saw the video, my heart really soared. This is exactly who we are and what we do. I'm incredibly excited that they are joining us today to play You Didn't Have to and to chat about their song. Sam Gray and Casey Brown, welcome.
Hello.
Thank you so much.
Hi there. I have a couple of questions for you.
Okay.
First, welcome again so much. Welcome. What made you decide to write You Didn't Have to?
You want to take this one?
Well, I mean, really, we have a lot of personal relationships and friends in the nursing community, and
including Sam's mom,
including my mom, who's been a nurse on the front lines for most of our life, for 35 years, and it just really touched our hearts what we saw our friends doing. We knew that we heard stories of nurses, and also COVID really shone a light on what nurses were doing for people, and really they were the point of communication and love between families, and basically we just wanted to reach out and share our thanks to all the hard work they were doing, and just the passion and unrelenting, beyond the call of duty that they were putting into their work, and it's the least we could do, really. Yeah.
So there've been a lot of people on the front lines. Why did you really single out the nursing profession? I think you hit upon that a little bit, but anything else to add about why the nursing profession in particular?
Well, my daughter was diagnosed this year with type 1 diabetes, and going into the endocrinologist's office with her, we see the doctor, but prior to seeing the doctor, you see the nurses. Mm-hmm. And the nurses are the ones really comforting the patients. The nurses are the ones that, get all of the information and spend, I think, the majority of the time with the patients. And especially with COVID and family members not being able to be in the hospital with or in the rooms with, and a lot of them can't have their phones and be on FaceTime even. The nurses are the ones that are holding their hands and that are praying for them and that are lifting them up and making them laugh. And I just think that this year, well, last year and this year, it has just really, frontline workers all the way around have been at the forefront of all of our minds and all of our hearts, but nurses, I think, just deserve a special thanks, and we're so grateful that we've had the opportunity to give thanks through this song.
Yeah, that's great. So how do you think COVID in particular has illuminated the work of nurses?
Well, the illumination really has been the isolation of everyone else. The nurses are the ones that are there. I mean, all frontline workers are there, but I think, again, the nurses are spending the majority of the time, in the rooms with masked up, gloved up, and loving on all of these patients when the families can't.
Right. I mean, obviously, it goes beyond a pay slip. It's and they've always done that for people. I think that COVID really, obviously it's a really awful thing, the pandemic, but the way it shone a light on this, I think, is a really great thing, because they've always been there doing that work, and they always will be there doing that work.
I know how I felt and what was in my heart when I heard this song. It's just incredible. What's been the overall reaction, other than me, and I keep telling you how excited I was to have heard the song, what's been the overall reaction, some of the comments that have come in from you?
Tears. I have seen in person tears from nurse friends that have listened to it in our presence. Just absolute tears. We were at a social distanced New Year's event at our next door neighbor's house, and 3 or 4 of the women that were there were also nurses, one of which spent the first 3 months of the pandemic in New York, and it absolutely just broke her. I mean, what she saw, what we see on the news, we wonder.
I can't imagine. I can only imagine, really, what they would have seen, and just to add to what you were saying, is like, the reaction is what we hoped it would have been as well, really, like seeing the YouTube comments and just comments from friends on Facebook and people that we don't even know. The way it's just, and if we can just help spur them on as well and give them encouragement and let them know that there's people out there that love them and really appreciate the work they're doing, that's a winner for us, and
absolutely.
Just spreading the love, man. They just deserve all the love. Really.
There was one woman that messaged us and said that she spent the first couple of months where she was only seeing her children through like a glass door, because she was exposing herself to something she didn't want to expose them to, and how much this song meant to her. And then there was another comment that really stuck out to me where she said, I struggle to go into work. I do it because I love it. I love people. But this song has kind of become my theme song. I listen to it every day before I go in, and it just puts me in a great mood, because I know that even when people don't say thank you, like, people are.
So, what do you hope listeners will take away from your song? The nurses have been at this for a very long time now. We know the pandemic is not going to be over anytime soon. We're thankful for the vaccines. So what do you hope the listeners will take away from your song?
Love and encouragement. Just strength to keep going. I think we all live off of love and encouragement, and that turns into the strength to keep going.
And it goes such a long way, and also not to take for granted the incredible work that the nurses and the midwives and people like that are doing behind the scenes, not to take for granted healthcare that we do get at the click of a button, you know, the call of a number. They're there waiting to treat us, and we can't take that for granted. You know, we have to spare a moment for those people that are really putting their own lives on the line, because, you know, so many, obviously people go out and fix a car up, or we write a song in the studio, and these guys are in the thick of it, you know, and they throw themselves into it, you know, and we need to just appreciate it.
My grandmother's been in ICU for 2 weeks with COVID, and it's the nurse that we talk to 2 to 3 times a day for the updates. You know, we can't get to her, we can't love on her, we can't send her flowers. You know, there's so many things. I'm like, what do we do? It's such a crazy time, and we're so dependent upon the nurses for the information being relayed to us and for the love being relayed to my grandmother. And this is how many of us, this is our story right now. And I couldn't be just more humbled and grateful for everything that the nurses are doing. But not just now, it's just this has kind of, like we said, illuminated what they've always done.
Right. Well, we are absolutely thrilled to have you, and drum roll, please. Without further delay, let's hear you perform. You didn't have to. Thanks, guys.
Thank you.
Thank you so much.
Here's to the ones that will never take credit. Here's to the ones that won't admit it. I hope you know we're all thanking God for you. And here's to the ones on call all night. Don't think twice about the sacrifice. Here's to the extra mile that you take it to. Here's to the frontline warriors for being brave for all of us. You didn't have to make him laugh or hold her hand like that. You didn't have to love, but you did, just to make them all feel better, yeah. You didn't have to pray all night. You didn't have to risk your life. Everybody loved like you did, the world would be a whole lot better. You didn't have to. No, you didn't have to. Being brave for all of us.
Yay!
Wow, thank you, Casey and Sam, again. Incredible. I tell you, when I first heard that song, Marcia Proto from Connecticut brought this song to my attention, and it was, I think, November, December, just when I think things couldn't get any worse. When I heard it and the recognition for nurses, it was just, it just struck my heart, Susan. I tell you, it just was wonderful. So I thank them again.
It's so beautiful. And others have noted in the chat also, just this morning in the New York Times, there was another video released, as well as a story that's called Death Through the Nurse's Eyes. And it's about and 2 nurses who wore cameras in a COVID-19 ICU in Phoenix, with permission, of course, and most people were blurred, except for the permission from one patient. And it's just so moving. And it goes so well with this song, Holding the Hand, having the videos to talk to family members, that connection to people. I just wanted to read one quote that I wrote down from a physician who was rather humble in his remarks, that he was there for 10 minutes typically, and then it's the nurses, of course, we know that, for hours and hours and hours taking care. And he said, let me read this. He said, let's say there is a day that nurses don't come to the hospital. It's like, why are you even opening? That's I always think hospitals are the business of nursing by and large. People are staying for nursing care by and large. So, and just at the end, the main nurse who was speaking was asked, what do you want to say to nurses who are watching this? And she said, thank you. Just like the song ends, like, thank you, thank you. And she says, you are all amazing. Of course, she's tearful. So quite an amazing connection to our discussion today in that song.
Right. So I would really recommend, I saw the video too, based on your recommendation this morning, Susan, and it was, it brought tears to my eyes about what nurses are doing. And if I didn't know any better, this sounds like this event is one big love fest for nurses, but it is about recognizing all of the hard work that everyone has been doing over these last 10 years. You know, and we have a panel coming up, Susan, and it's going to talk about some of the accomplishments of the last 10 years, and we'll be hearing about some of the recommendations. But I thought it would be fun. That it would be fun if you and I could talk about maybe what recommendations were kind of our favorites from the last report. I know I have some from the report going forward, but that's for another time. But shall I start?
Yeah, I'm like, what's yours?
Yeah, so I think for me, there were so many wonderful recommendations, but because I'm an associate degree nurse, that's how I started out my career, 2-year nurse from South Florida. And then I knew pretty much right away that I wanted to go on for my baccalaureate degree. But in the 70s, yes, I gave away my age now. In the 70s, it was really hard to find a program to go to for a baccalaureate degree where you didn't have to repeat everything. So I did go on, but I will tell you that this recommendation is so important to me. Just now today, hot off the press, we know that in the last 10 years, the RN to BSNs has gone up 236%. So we have many, many more baccalaureate nurses coming into our system now. I think the other recommendation that's really important to me and the foundation was doubling the number of nursing doctorates. We know that we have done that. We met that goal because of the DNPs, but Robert Wood Johnson Foundation chose to create a program, Future of Nursing Scholars, to really bring forward the next generation of nurse scientists. Really, really important, not only for knowledge generation, but to fill our faculty slots as well. So let me ask you, did you have a favorite recommendation?
Yes. And I also want to thank Tony and Marcus, because their focus was so much on the consumer. And of course, I'm at AARP with 38 million members, consumers, not to mention their families. And so when I first got here about 14 years ago, I had states asking me, state offices asking, we've got these bills, and they're called scope of practice, blah, blah, blah. And we don't want to get into a turf war with nurses and physicians. What do you think we should be doing? So just to cut to the chase, I did collaborate with our chief advocacy leader, Nancy Lamond, and some of her key staff, Elaine Ryan, who works with states on state advocacy, both of whom are caregivers. And, AARP cares about access to care. That's one of the reasons it was formed to begin with. Access not just for older people, but for all of their family members. 70% of them, by the way, are grandparents. So they are really, really into childcare also. And so that's what we've done. This recommendation really opened up that wide open to say, bring the consumer's voice to this discussion. We're not the nurse lobbyists. The nursing organizations have been fantastic. I used to lobby for the New Jersey State Nurses Association part-time, but we do partner with them and bring that consumer view of, let's make it easier to find care. Let's make sure we have adequate care for people on Medicaid, for example, and underserved communities in rural areas. Let's make sure people can stay at home. These are high priorities for consumers. So this is obviously passionate. We fund this, by the way. Any advocacy that is done lobbying-wise, AARP is paying for, because as you know, philanthropic organizations can't do that. So we have volunteers, we have our state offices, and a lot of collaboration with nursing organizations and other business and other champions around this. So here's to more progress in the future.
So it sounds like your favorite recommendation was that nurses should practice at the top of their education and training. Yeah, we're grateful. So Robert Wood Johnson Foundation, the organization that I represent, very grateful for the partnership with the AARP, because as Susan said, the lobbying arm, they call them the red shirts, have gotten out there with so many other people around the country. This campaign could never have done what it did without the work and passion and everything of everyone around this country. And, Susan, there was a question that came in too that talked about, I think there was a person who said, I'm not a nurse. What's the connection for me? Can I be involved here? Well, this is about you. We need your voice, and even more so going forward. If the first report was about building the capacity of nursing, yes, we're still building the capacity, but now that we have that capacity, we've got to ask the nursing profession, what are you going to do with this now? And it's really to achieve health equity, to really understand the social determinants. So we need people in the community who we work with, who we can listen to, other sectors. We will never achieve health equity as a singular organization. The key is going to be, Susan, not only interprofessional collaboration, but multi-sector partnerships as well. And that certainly means people like this person who said, I'm not a nurse, how can I be part of this?
And let's hear from more people like that, more organizations. Thanks. So I think we're running a little behind, but maybe a few trivia questions if you feel like it, Sue?
Yeah, so let me, so if you want to play along, simply enter your answer in the chat like you did before. Okay, so Susan, you want to take the first one?
Yeah, well, about access to care. So of the 332 million people in the United States, approximately how many people live in states that allow nurse practitioners and other advanced practice nurses to provide care and services to the full extent of their education and expertise? So you can see their choices. All of them, half of them, a quarter of them, none. And the answer is...
Yeah, that's a giveaway. Yeah.
The answer is C, 72 million, only a quarter of the population. So we've made a lot of progress, but we certainly have more to do, clearly.
So here's one of my very favorite topics coming from a philanthropic organization. And we've tried to work so hard with the action coalitions to help them raise their own funds as well. So for the last decade, often these volunteer-based action coalitions, and they've garnered so much financial support over and above RWJF and AARP's investment. So the next question is this. From 2010 to the end of 2019, how much money have the campaign state action coalitions raised from sources other than Robert Wood Johnson and AARP? $15 million, $45 million, $75 million, and $900 trillion. Ooh, I'd like the last one, actually. Of it be the last one? Well, maybe next time. The answer is $75 million. And a lot of that came about, Susan, when we had grants programs to the action coalitions, and we asked them to match the funding from RWJF, and they did that.
They did it in a big way. So we've also engaged a variety of community philanthropic organizations to do this. So it's been great.
So in addition to funding the action coalitions, we've also engaged a variety of community partners at the local, state level, including health and hospital systems, local foundations, county fire and emergency services, and even the state councils, state health departments. Since we last surveyed at the end of 2018 collectively, how many organizations have joined this work? 700? 1,100, 1,850, 2,200. All right, if you said D, you're correct. The campaign has worked with over 2,200 unique organizations and community partners at the state and local levels. And speaking of partnerships, Susan.
It gives me great pleasure to introduce our next guest, my esteemed colleague, Lisa Marsh-Ryerson. Lisa is the president of the AARP Foundation, which is the charitable arm of AARP, and alongside with the Robert Wood Johnson Foundation, has been the pillar of support for the Campaign for Action. As the leader of the AARP Foundation, Lisa has spearheaded pioneering initiatives to realize the Foundation's vision of a country free of poverty where no older person feels vulnerable. Nurses have long been an integral part of that vision and remain so today. And I'll let Lisa tell you more.
Good afternoon, and thank you, Susan, for your kind words. I'm delighted to be with all of you today at the Future of Nursing, Passion, Purpose, and Progress 2021 Summit. And it gives me tremendous pleasure to join Dr. Richard Besser and Dr. Susan Hassmiller from the Robert Wood Johnson Foundation, along with my AARP colleague, Dr. Susan Reinhart, and all those who have joined us today to honor the extraordinary contributions nurses have made to our nation's health over the years, and especially during this past year. In 2007, the Robert Wood Johnson Foundation, AARP, and AARP Foundation created the Center to Champion Nursing in America to ensure all people in this country have a highly skilled nurse when and where they need one. In 2010, that same group joined forces to create the Future of Nursing Campaign for Action to harness the power of nurses as essential partners in providing care and promoting health equity and well-being so everyone has the opportunity to live longer, healthier lives. And since then, AARP and AARP Foundation, with the extraordinarily generous support of RWJ Foundation, have worked hand in hand with the Center to Champion Nursing in America to strengthen the nursing profession. We've highlighted the critical role nurses play in creating a healthier nation and in advancing the cause of health equity in our country. Our collaboration has made tremendous progress. We've lifted restrictions on nurses to expand access to care for almost 60 million people. We've helped pass laws so consumers have easier access to care at home, and created a mentoring program and toolkit for nursing programs to build a more diverse and inclusive nursing workforce. And that's just in the last year. This past year has also tested our nation and its nurses. The need for skilled nursing has never been clearer. Nurses have shown tremendous courage, fortitude, and selflessness in meeting the needs of patients who are ill and their families who are caring for them, often caring at a distance. Yet nurses have faced difficult times too, from sickness in their ranks to burnout, grief, and worse. On behalf of AARP Foundation and countless others, I offer a heartfelt thank you to nurses everywhere for your everyday heroism and your grace. Nurses have borne witness as the tragic disparities in health and access to quality health care that have plagued our country for so long have come to light. These disparities in who gets sick and who dies, who gets care and who does not, did not suddenly appear with COVID-19. They have been here all along, hiding in plain sight, a product of the long-standing and shameful inequality that stems from a lack of economic, social, and political opportunities from racism, discrimination, and poverty. To tackle these disparities, we must focus on the social determinants of health, factors such as education, access to healthcare, jobs, housing, food, and social isolation. These factors affect people's health from cradle to grave. Because nurses are so closely involved with patients, they have a window into the social determinants that often cause great damage to patients. And as part of the healthcare system, they are well positioned to create and be part of the solution. AARP Foundation shares nursing's commitment to fighting health disparities. Our mission is to create a world without senior poverty where no older adult feels vulnerable. We invest in and create effective solutions that help tackle the root causes of poverty, racism, and discrimination. One key social determinant of health is food insecurity. And nurses understand this well. They understand how food insecurity harms health, and they can and they do play a key role in addressing the problem. They can screen patients for food insecurity during medical visits and provide food prescriptions to refer patients to community resources that can and do provide reliable food access. Some, like nurses in Washington State's Bayanihan response to COVID-19, go farther. These professionals held weekly phone check-ins and screenings with high-need elders to assess them for COVID-19 symptoms and for food insecurity and other social determinants of health. Elders in need were offered a grocery and meal delivery program to ensure their access to nutritious and culturally appropriate food. This effort is just one of many examples of how nurses get involved in their communities to advocate and to act for a culture of health. Nurses also have a key role to play in addressing the crisis of social isolation, another important social determinant of health to which AARP Foundation has long been committed. It is no surprise to all that social isolation dramatically worsened during the pandemic, especially for older, low-income adults. Social isolation, as we know, is associated with an increased risk of heart attack, stroke, dementia, depression, and early death from all causes, and it must be taken seriously. Last year, AARP Foundation sponsored a National Academies of Sciences, Engineering, and Medicine consensus study that recommended addressing social isolation by strengthening ties between the healthcare system and community-based networks and resources. And nurses played a significant role on the National Academy's expert panel that studied this issue and that issued the study. And they have a critical part to play in implementing its recommendations. The study noted that nurses provide an essential link between hospitals and community environments and perform a significant function in assessing patients' social, psychological, and physical health needs and making referrals to community services that can and do address social isolations in older adults. Overcoming health inequity and the social determinants of health is no small task. No one group or organization can do it alone. At AARP Foundation, we speak of the uplifting power of partnerships and cross-sector collaboration to achieve the best, most effective, sustainable results. We have seen it in our work with the Root Cause Coalition, where we partner with a broad cross-section of groups and organizations in many different sectors, all committed to achieving health equity through our focus on the social determinants of health. And I believe there really is no finer example of the power of partnerships and collaboration than the one that has powered the Future of Nursing Campaign for Action, housed at the Center to Champion Nursing in America. This is, of course, in part because the involvement of my many talented and hardworking colleagues at AARP, Dr. Susan Reinhart, Chief Strategist, and our friend and colleague, Robert Wood Johnson Foundation's Dr. Sue Hassmiller, Campaign Director. Both are nurses. The fantastic CCNA team, including directors Mary Boyle, Jennifer Peed, Pat Polanski, and Wynn Quinn, and their extraordinarily dedicated team, including Jasmine Cooper, Jordan Green, Claudio Galtieri, Anna Harvada, Aiden McCallan, Lynn Mertz, Nicole Roscoe, Stacy Sampson, and Scott Tanaka, and of course, the nationwide network of nurses, far too many to name, who my colleagues and I will continue to champion. Though the road to health equity for our nation, especially for those in underserved communities, will be long, AARP Foundation is proud to be on this journey with the Robert Wood Johnson Foundation, AARP, and the dedicated and talented nurses nationwide. Thank you all.
I am Edna Cadmus, and New Jersey was one of the first action coalitions in this country. At that time, they were called RACs, Regional Action Coalitions. Through this journey, we have engaged over 200 nurses and engaged a diverse board made up of partner organizations to both build capacity and create a bridge to creating a culture of health and equity for our state. If you would allow me, I would like to share with you some of our key accomplishments. First, academic progression. We have impacted curricular changes across programs by building partnerships. 67% of our nursing workforce has a BSN or higher. We have placed over 300 undergraduates and graduate students in community settings. We have implemented nurse residency programs, with over 100 being placed in out-of-hospital settings and over 400 new graduates and 19 hospitals participating in a statewide initiative for a transition into practice program. We have educated over 268 school nurses in youth mental health first aid and created a toolkit for school nurses on how to take the framework for 21st century school nurse programs and make it actionable. We have educated over 60 community organizations and members on mental health first aid for older adults. We have educated our legislators on access to care barriers and on long-term care bills being legislated in the state of New Jersey. We have received over $2.6 million in funding from external sources to help us in achieving our work. These accomplishments are due to the hard work of many, both nurses and our partners. Now, let me introduce my distinguished colleague, Rita Ray from Mississippi, also one of the first 5 action coalitions at the start of the campaign back in 2010.
Greetings, I'm Rita Ray, Action Coalition Lead from Mississippi, one of the first 5 original action coalitions and still standing. It was truly my privilege and a pleasure to have been chosen as one of the first 5 coalitions to implement the recommendations from the Institute of Medicine, The Future of Nursing. When I look in my rearview mirror of the past 10 years of my and Mississippi's involvement in the campaign for action, I'm reminded of our foundation, consisting of over 40 core industry stakeholders in healthcare, government, business, and higher education, as we came together in January of 2011 to kick off our efforts by developing a strategic planning map. The map helped us not only to focus, but it informed our implementation teams. We had a team for each pillar: education, leadership, practice, and diversity. As our strategies and tactics were developed, we were on our way to addressing the recommendations laid out in the Institute of Medicine's report. Successes for many, but two come to mind. One in education, creating BSN programs with seamless academic progress in preparation of nurses. And the second in leadership, creating a nursing database and successful placing of nurses on boards. This served as a springboard with our work with Nurses on Boards Coalition, where we are celebrating an achievement milestone of 10,000 nurses on board by 2020 and envisioning what's next. Our challenge remains securing legislation allowing nurses to work to the fullest practice authority. Of note, we intentionally sprinkled diversity, primarily in race and gender, throughout our coalition and our action plans, as well as we made a successful transition a few years back to incorporate creating a culture of health throughout our 4 pillars. The coup de grace is twofold. First, securing and maintaining sustainable relationships such as with the Office of the Governor and the Mississippi Department of Health. And secondly, because we had known each other since we were baby nurses, the strengthening of the relationship bond is formed in the initial group. So tackling this project for the last 10 years has truly been a labor of love. The foundation has been laid, and I look forward to an impactful future, continuing to make a difference in our communities. And now I pass the baton to Bill Novelli, who was the CEO of AARP during the Campaign of Action and the Center of Champion Nursing in America's inception.
Hello, I'm Bill Novelli. I was CEO of AARP when the Center to Champion Nursing in America and the Campaign for Action began in 2010. This partnership between the Robert Wood Johnson Foundation, AARP, and the AARP Foundation has resulted in extraordinary progress over the last 10 years. The partnership was based on the Future of Nursing report issued that same year by the Institute of Medicine, now the National Academy of Medicine. I was privileged to serve on that report committee. The purpose of the Campaign for Action partnership was to work for the implementation of the Future of Nursing report. We didn't want it to just become another shelf document. I'm very proud of what's been accomplished. To me, the most important report recommendation was to expand nurse leadership across the entire profession, throughout the healthcare universe and beyond. I believe in nurse power. I've worked with nurses in virtually every social impact program of which I've been a part. Nurses are natural leaders. They have the commitment, competence, and character to lead. And they're proving it right now during the COVID pandemic and the health inequities that we all face. The campaign has made a big difference in helping nurses move into leadership positions. And the real champions have been the nurses themselves. Nurse power is an extraordinary force to help move our country forward. So let's keep up the great work.
Hello, I'm Pat Polanski, Director of Program Development and Implementation at CCNA. As you just heard from Bill Novelli, nurse leadership is critical, and it quickly became a huge priority for the campaign. Dozens of our state ACs concentrate on developing leadership programs, leadership recognition platforms, and training modules for nurse leadership to elevate nurses to critical leadership positions, not just in nursing arenas, but across all of healthcare in America. In 2012, we began to sow the seeds of a major push to markedly increase the actual numbers of nurses on boards. CCNA started that conversation with just one tri-council leader and then a second. And over several years' time and many meetings, that initiative grew to a cohesive group of 21 influential and critical nursing and national stakeholders, including AARP and the National Student Nurse Association. Ultimately, that group became the NOBC, and we held our first meeting the morning of the National Summit in 2014 in Phoenix. Shortly thereafter, I met with two of our CCNA nurse consultants. We brainstormed for 2 solid days, and using the innovative Harvard BHAG concept, we visioned a bold, hairy, audacious goal, and that was 10,000 nurses on boards by 2020. Bold indeed were we. Then in 2015, we legally transferred the NOBC entity itself to the AARP Foundation. And as they say, the rest is history. Lori.
Greetings and congratulations as we come together to highlight, recognize, and celebrate the extraordinary contributions of the Future of Nursing Campaign for Action based on a decade of passion, purpose, and progress. There has never been greater recognition of the importance of including the nursing leadership perspective in all settings, including the boardroom. When the Nurses on Boards Coalition first convened in 2014 to implement the recommendations of the 2010 IOM Landmark Report, later that year, they announced the partnership and the key strategy that 10,000 board seats should be filled by nurses in 2020. Well, just a few short weeks ago, we achieved this historic milestone together. We want to thank each of you in joining, as this is a proud day for nurses, the profession, and all those we're privileged to serve. And now we can turn our attention to measuring the impact of nurses on boards, as well as broader awareness that diverse nurses can contribute in all board settings in order to improve health for all, address the social determinants of health, and promote a culture of health. As we await the 2020-2030 Future of Nursing Report, please know we are ready to join alongside with you in ushering in a new decade of fulfilling the promise, potential, and impact of the positive power of nursing leadership. Bring on the future the world awaits. Count us in. Congratulations and thank you to all.
Hello, everyone. My name is Blake Smith, and I bring you greetings from Omaha, Nebraska. I am honored to be here to celebrate with all of my amazing colleagues from around the country. I can truly attest to the success of the report because I am just one of the countless examples of that investment into our profession. I started my nursing journey in 2010, searching for nursing schools. And I would like to specifically give a shout out to the Robert Wood Johnson Foundation as a proud alum of the New Careers in Nursing program. You were the catalyst of my success and the 3,500 nurse leaders today from this one program alone. The NCIN team pushed me to become my best self, challenging me to get outside my comfort zone and ultimately find the current passion to advocate for my fellow colleagues and the communities of underrepresented groups. As we celebrate our successes today, I would like to thank all those who worked so hard to develop the vision of the report and shape the profession for the next generation of nurses to be successful. I would also like to address my peers who benefited from the last decade. It is now our responsibility to stand up and lead with our mentors side by side. It is our responsibility to build upon those who inspired us and inspired those who, many like us in 2010, are now preparing to become the next generation of nurse leaders. I am so excited for the continuation of our journey. And may not just 2020 and 2021 be the years of the nurse, but the next entire decade. Cheers, everyone.
My name is Mary Sue Gorski, and I am a consultant with the Center to Champion Nursing in America. And I've been with CCNA since early in the Campaign for Action. And I am thrilled to be here today to share with you some successes of the education work in the Campaign for Action. We currently have the most highly educated and diverse nursing workforce ever. This past decade has seen a revolution in nursing education. Academic progression is now an expectation in nursing programs and recognized as essential to prepare the higher educated nursing workforce we need. The curricular innovations and partnerships have changed the way we think about nursing education. It's a good thing too, because changes in our healthcare system, coupled with the more recent global pandemic, continue to drive an unprecedented need for nurses. Since the campaign began, there has been an historic increase in baccalaureate-prepared RNs, as well as doctorally prepared nurses. These historic changes were fueled by Robert Wood Johnson Foundation and AARP programs that helped nurse educators from 47 states refine and evaluate academic progression models. Unprecedented partnerships were forged with community college trustees and administration, state and local government agencies, and across disciplines. The greatest impact was seen when there were strong partnerships between community colleges and universities and integrated curricula across those same institutions. The partnership models found to be so essential to success are also cost-effective because they use existing educational infrastructure across institutions. Knowing the positive effect on health outcomes, the education transformation process included a focus on aligning the diversity of nurses with the individuals they serve. The increases seen in the diversity of the nursing workforce is unprecedented and provides the nursing profession a stronger foundation to address injustices revealed by the pandemic. Lots of work to do there. The Future of Nursing 2010 report called for nurses to lead change and advance health, and the nursing profession embraced the challenge. Nurses navigate the complex needs of individuals in a variety of settings. The strides made in the last 10 years position the nursing workforce with the education and diversity to address social determinants of health and to lead efforts to improve the health and well-being of individuals now and in the future. So now let's celebrate the successes in 2 states. My colleague, Dr. Jean Giddens, was a leader in the state of New Mexico when they started their education transformation. Dr. Giddens was also instrumental in as a national nursing education expert throughout the campaign. The state of Hawaii has been a leader in increasing the education and diversity of their workforce, and Laura Reinhart will tell us about that journey.
My name is Laura Reinhart, and I'm the director of the Hawaii State Center for Nursing and a co-lead of the Hawaii Action Coalition. Between 2012 and 2014, we were an APIN grant recipient, and we've sustained this program since that time with community partnerships. We were the first state to engage our employers in the strategy, in the leadership, and the action plans. Because of this, our employers have strong professional development initiatives that include academic progression for their nurses. We also worked with our community colleges and universities to strengthen their partnerships and supported the public university system in creating a shared curriculum between their community colleges and their universities. Because of this, we have seen incredible advancements in our BSN population of nurses, particularly in our rural communities. Before these initiatives, we saw less than half of our rural nurses with a BSN, and now over 50% of our neighbor island rural nurses hold a baccalaureate degree or higher in nursing, including a 7 to 8% percentage point increase in the last license renewal cycle alone. Because of APIN, Hawaii has moved from 59% in 2010 of our registered nurse population with a BSN or greater to 74% in 2019. This is a 15% increase in just 9 years. This has been a great program. It has strengthened the partnerships across our state, and we are so grateful for the Campaign for Action for inspiring us to do this work. Aloha.
I'm Jean Giddens, Dean and Professor at the Virginia Commonwealth University School of Nursing in downtown Richmond, Virginia. I am so honored and pleased to share with you an exemplar that I was involved with that represents one of the many successes of the Future of Nursing campaign in the area of education. Prior to my current position in Virginia, I lived and worked in New Mexico. The nurse educators in New Mexico formed the New Mexico Nursing Education Consortium with the goal to increase access to baccalaureate nursing education to students throughout the state. And this would lead to increasing the number of baccalaureate prepared nurses for the New Mexico workforce. How did we do this? We created a statewide concept-based curriculum shared by participating pre-licensure nursing programs from across the state. Second, we formed strong university community college partnerships. Students attending a community college are co-enrolled with a partner university. Some courses are offered by the community college and some courses are offered by the partner university. Students earn an associate degree from the home community college and they also earn a bachelor's degree from the partner university at the time of initial graduation. This eliminates the need for students to go back to school to earn a bachelor's degree. All courses are taken in the home school or online. This program has led to a significant increase in the baccalaureate prepared nurses entering the workforce in the state. Not only has this model been supported by nurse educators from across the state, but it has also gained the attention and support from the New Mexico governor. Funding has been received through New Mexico state appropriations and from the New Mexico Board of Nursing to support the continuance of this program. This is truly a success story. 16 programs, 1 curriculum, and an increase in the number of baccalaureate prepared nurses. And even though I'm no longer in New Mexico, I remain so proud to have been part of this effort and continue to support academic progression. I have created co-enrollment partnerships between VCU School of Nursing and several community colleges in Virginia, which will accelerate the completion of the bachelor's degree. Additionally, with the support of generous donors, we are able to offer scholarships to these students to offset additional costs associated with completing the bachelor's degree. I am really passionate about academic progression, and working in this area has truly been a highlight of my career.
As a healthcare provider practicing in a state that has some restrictions, I can personally attest to caring for patients who really don't have good accessibility to healthcare. But there's good news. This campaign has had 27 states to come on board and change laws that have increased the accessibility to healthcare for several of their consumers and allowed those healthcare practitioners, nurse practitioners, to be able to practice at the fullest scope of their education. 10 states have even modernized things so much, whereas there's still some work to be done, but some of those old antiquated laws are no longer there. And last, I'd just like to say that nursing leaders, state action coalitions, and AARP members have been working diligently and have gotten the needle moved a little bit. There's some progress made, but there's still so much more to be done.
For decades, attempts were made to improve access to high quality and safe patient care through advanced practice registered nursing services. Finally, in 2020, the California legislature passed and the governor signed into law 2 bills that substantially improved consumer access to nurse practitioner and certified nurse midwife care in our nation's largest state. National experts, including one of the Campaign for Action Strategic Advisory Committee members, Dr. Heather Young, and a Robert Wood Johnson Foundation trustee, Dr. Linda Burns Bolton, served on a Blue Ribbon Workforce Commission making the evidence-based case for action. Just as important was the change of heart from an unlikely but crucial champion. Assemblymember Dr. Jim Wood, a dentist, voted against a 2015 bill to modernize APRN scope of practice. However, he became convinced a change was desperately needed when he saw a widening gap between primary care providers and the growing needs of patients, especially in rural and inner city underserved communities. As a clinician in an underserved rural area, he put it all together, and this convert led the charge. Health Impact, the California Nursing Workforce and Policy Center, is also the California Action Coalition. Volunteers and staff of Health Impact played a crucial role in improving health through nursing practice in California. Congratulations to everyone who worked tirelessly in the campaign for action. We've made significant progress over the past 10 years.
The New Jersey State Nurses Association, our Forum for Nurses in Advanced Practice, our Society for Psychiatric Advanced Practice Nurses, and several stakeholders, including the AARP chapter in New Jersey, Rutgers University, the New Jersey Association of Nurse Anesthetists, and the regional chapter of the American Association of Nurse Practitioners, have been involved in the campaign to put into law full practice authority for New Jersey APNs. This process has been both arduous and long and has continued over 14 years. Several political roadblocks have affected our progress, including the inability to get the bill posted in the New Jersey Senate for a full vote. During the COVID-19 pandemic, New Jersey Governor Murphy issued Executive Order 112, which waived the requirement of a collaborating agreement. The collaborating agreement between a physician and an APN allowed APNs prescriptive privileges. This action by Governor Murphy created increased access for our residents to APNs, providing healthcare services, including mental health services, to help both with routine healthcare and to fight this pandemic. APNs have proven that they can safely and effectively care for New Jersey residents without the barrier of a collaborating agreement. Although the governor's executive order is temporary, we are assured that it will assist us to mobilize increased support to make removal of the collaborating agreement a permanent policy.
I'm Sarah Hexam Hubbard, and I'm coming to you from Pennsylvania, from the Pennsylvania Action Coalition. Over the last year, COVID-19 pandemic has definitely brought to light the seriousness of our healthcare provider shortage, especially in rural and underserved areas of Pennsylvania. So patients, politicians, health systems are realizing that patients want and need more healthcare options, not fewer. Common sense approach to this issue with, at this point, decades of data to support it is the implementation of full practice authority for nurse practitioners. And after years, approaching a decade now, of tireless advocacy by nurses and patients, we've built bipartisan support for the issue. And the bill has actually passed out of the Senate by an increasingly wide margin the last few sessions. However, until last session, efforts to expand NP care have always stalled in our House. Last year, the bill finally received a hearing, and while it was heavily amended, it did pass out of the chamber with almost unanimous support. The bill as passed is flawed, but we are heartened by the growing recognition of lawmakers that the public deserves access to the NP workforce. As we embark on the new legislative session, that bill died with the end of the session last year. We are rebuilding, and we're working with consumer advocates and other healthcare allies to capitalize on this moment and the opportunity for common sense bipartisan healthcare policy. We are working to educate legislators on the pitfalls of the amended scope of practice bill and how it really would do little to materially deliver patient benefits, as well as the benefits of a pro-consumer bill that can actually expand access to patient care. So we have a tough road ahead. Been a long road to get here, and certainly more work ahead. But we're optimistic, and there's really a renewed sense of urgency, both among our advocates and stakeholders, among the public, and then also for our lawmakers who really want to be looking at expanding access to care. So we're ready. We're ready for the next steps, and we're gonna do it. We're confident that we're going to be able to join At this point, almost 24 other states, 23 states and DC that have already modernized their laws to improve access and health.
Hello, I'm Carmen Alvarez, and I have had the honor of serving as co-lead for the Equity, Diversity, and Inclusion Steering Committee for the campaign. A little over 10 years ago, the Future of Nursing report was released with recommendations for how the nursing profession needed to prepare and reinvent itself in order to optimize care for the public. Leaders of the campaign had the foresight to recognize that advancing the profession for the health of the public could not happen without a workforce that represents the diversity of the nation. To achieve this goal, the campaign worked to increase awareness about the importance of diversifying the workforce, foster agreements among stakeholders for how to achieve a more diverse workforce, and committed to action for realizing this goal. This commitment included investing in programs and initiatives to not only increase enrollment of underrepresented groups in nursing, but also increase successful completion. For example, the campaign partnered with the Office of Minority Health on a mentorship training program for historically Black colleges and universities. The goal of this program was to increase retention, graduation, and pass rates for the nursing board exam. These efforts have and are working. Great progress has been made to where we now have more Black and African American, Latino, and men in nursing. And there's so much more work to be done. Many communities of historically marginalized populations continue to be disproportionately affected by a plethora of health conditions, and COVID-19 has been no exception. Addressing these disparities and achieving health equity require the insights, innovation, and leadership of a diverse workforce. The pandemic and recent calls for social justice have heightened the importance of the campaign, particularly the work of our Equity, Diversity, and Inclusion Steering Committee. Our mission goes well beyond diversifying the workforce. We are working to educate the public about how nurses from underrepresented groups have been and continue to work towards achieving a culture of health. We are calling on nursing stakeholders to ensure diversity in all tiers of leadership and work environments that embrace inclusivity and inspire sustainable solutions for addressing health disparities through research, education, policy, and practice. We are calling for a commitment to action for realizing health equity for all.
Hello, my name is Deborah Stamps. I am one of 3 co-leads for the New York State Action Coalition and the Executive Vice President, Chief Nursing Education Officer, and Diversity Officer at Rochester Regional Health in Rochester, New York. I am also the second Vice President for Chi Eta Phi Nursing Sorority, which is an organization of professional student nurses and registered nurses from diverse backgrounds. Health equity is our true north in healthcare. Health equity is the underlying principle and commitment that is to reduce healthcare disparities and ultimately eliminate them. It also is ensuring that all people in our communities that we serve have access to equitable, high-quality care. Health equity is our true north. Health equity is the principle underlying a commitment to reduce and ultimately eliminate healthcare disparities. This actually aligns with the Robert Wood Johnson work around the culture of health. Health equity can be achieved by every person, and every person has the opportunity to attain his or her full health potential. We have witnessed with COVID-19 that healthcare disparities are still in existence. Despite the many years of work and effort to reduce them, there is still opportunity. One of the ways that we are working to reduce healthcare disparities is through a diverse workforce. We have a mentoring collaborative with HBCUs, and the focus of those HBCU collaboratives is on mentoring student nurses, as well as providing support to faculty to ensure a diverse workforce. Chi Eta Phi sorority has many student nurse chapters, where student nurses are mentored, coached, guided, and supported through scholarship from the student nurse role to the transition to practice in various clinical settings. We know that nurses play a big role in educating our community, and through a more diverse workforce, we're able to reach the diverse communities that we serve and enable them to make better healthcare decisions, therefore leading to a sustained model of healthcare disparity reduction. We must continue intentional, innovative partnerships and solutions that support development and sustainability of a diverse workforce that leads to health equity for all.
Hello, my name is Nina Vedrauji, and I'm honored to be speaking today as a byproduct of the Campaign for Action and all that it stands for, guiding nursing education, practice, leadership, and diversity, all grounded in the importance of data. I have had the privilege of working with the New Jersey Action Coalition for the past 8 years, and that engagement has monumentally shaped my nursing worldview. In designing and launching many projects to help our nursing workforce, the most recent project, matching nurse volunteers to community-based organizations, has not only influenced my doctoral work at Yale University, but it has elevated my future aspirations for enhancing leadership skills for nurses across the spectrum of experience. With mentorship from my NJAC nurse leaders and convening with action coalitions over the years, I have developed a vision for the nursing legacy I wish to create. I strongly believe that when passion meets purpose, nurses are unstoppable. Given the current climate that we are in now, with racial disparities at the forefront, a worldwide pandemic, and overall unrest in our nation, nurses have an unparalleled opportunity to be pivotal leaders as we remain the most trusted profession. My goal is to inspire and elevate our next generation of nurses who will lead with passion and purpose and champion every opportunity for progress. I thank the Robert Wood Johnson Foundation, AARP, and the Campaign for Action for their dedication in illuminating the future of nursing over this past decade. Now, as we move forward, and in the sentiment of Amanda Gorman, nurses will rise in this light that has always been there. We will be brave enough to see it and brave enough to be it. Thank you.
Nursing is the largest segment of the healthcare workforce and the most trusted profession. It is also key to improving health and well-being of the United States.
Nurses have clearly shown the power of the nursing profession. Nurses today are making a world of difference.
Helping nurses to make that difference, the Future of Nursing Campaign for Action, a national initiative of AARP Foundation, AARP, and the Robert Wood Johnson Foundation, was established in 2010. The purpose was to implement recommendations of the Institute of Medicine's first Future of Nursing report and to harness the power of nursing to build a healthier nation. Many thousands of nurses and nursing organizations in this country and globally help to achieve this goal.
The Campaign for Action did not allow our report to sit on a shelf. It combined the report with an action plan that organized the states and nurses in particular across the country to implement the goals of the report. That made a huge difference.
Those differences included giving consumers more access to care by modernizing state laws that prevent nurses from practicing at the top of their education and expertise. Transforming nursing education so nurses are prepared to meet increasingly complex health needs in all settings, including more nurses who are baccalaureate prepared and more nurses educated at the doctoral level. Improving the health of communities and the nation through the service of nurses on boards and other bodies, and increasing diversity and inclusion in nursing so that we have a nursing workforce that reflects the communities it serves. All that work built nursing's capacity, so when the pandemic came, they were ready.
the first nursing report did prepare nursing for COVID because it raised the quality of nursing education in this country. It focused on outcomes for the patients. It put more nurses in leadership positions, which certainly made a difference. And by doing all of that, nursing was more ready for COVID, and the health institutions were more ready because they adopted the changes that we insisted upon.
Now, after 2 years, including a 6-month delay to revise the scope of the report to include nurses' role in the pandemic, the National Academy of Medicine is nearly ready to release its second Future of Nursing report.
This particular report had a very ambitious challenge, and that was to produce a consensus report that charts a path for nursing for the next 10 years, and actually beyond even that, with the explicit aim of helping the nation to create a culture of health, reduce health disparities, and also improve the health and well-being of the U.S. population.
I think nursing's most urgent calling is the calling of the health equity, and that's what the new report brings to it. I think Mary Wakefield is the perfect person to have chaired that new report, but that's the centerpiece. Mary, I'm honored to pass this baton to you as a symbol of bridging the first Future of Nursing report with the second. It's all yours.
Thank you, Dr. Shalala. My co-chair, Dr. David Williams, and I are absolutely delighted to take the baton from you. Your work and that of your committee set a very high bar, and it also built an important foundation for this next report, the work to advance health equity through the nursing profession.
Continue this journey with us to address the most pressing challenges of our time. We need you more than ever. Sign up at campaignforaction.org/joinus2030. At this time, we want to recognize and honor each one of you who have dedicated so much of your time and energy making the Campaign for Action an enormous success over the past decade. Let us begin by thanking the hundreds of Action Coalition leaders over the past 10 years. Thank you again for everything you have done to make the Institute for Medicine Future of Nursing report, Leading Change, Advancing Health, become a reality for millions of people.
Wow, it's so great to see Congresswoman Shalala pass the baton to Dr. Wakefield and hear these two future of nursing leaders talk about the impact and future impact of their reports. Thank you both so very much.
And to see the names of our Action Coalition leaders, our esteemed campaign advisors who have helped guide us, the learning collaboratives where we shared and learned over so many years, our grantees and award winners, our stakeholders. Thank you all. We and nursing are indebted to your passion, hard work, and commitment.
And that brings us almost to the close of our meeting. We want to thank our speakers and all of you who chose to spend the last 3 hours with us. Thank you so much for joining us.
And I'd like to thank the staff at the Center to Champion Nursing in America for putting together this meeting. It was a lot of work, as I'm sure you can imagine, and I'm grateful for each of their contributions to this wonderful afternoon.
Now, please find a glass. We're going to have a toast to all of you and all the work that you have helped accomplish. Please raise your glasses. Today, we have come together reverent and mindful of our past accomplishments and to celebrate the enduring legacy of the Future of Nursing, Leading Change, Advancing Health 2010 report. With passion in our hearts and resolve for the unknown before us, we will continue to build on the progress we have made on this decade-long journey.
This quest has truly galvanized our profession and made known our true purpose. We, the most trusted and highly respected profession, 4 million strong, will now and forever be beacons for a healthier tomorrow and a more just society for all. Cheers.
Cheers, everyone.